Hey y'all, welcome back to my channel. So happy to have you here. In today's episode of In the Clinic, we're going to be talking about vaccinations, what you need and what you may not need. So stick around. So let's get this party started. Thank you so much for coming back to my channel. For those of you who are new, so happy to have you here and hopefully you'll stick around. Please don't forget to hit subscribe, like, and ring the bell so that way you can get updated on all new topics and vlogs and videos that I post. So last episode we talked about finding a PCP. And basically, I equated having a primary care physician or primary care provider essentially to being a pediatrician for adults. So when I think of a pediatrician, the one thing I think of are vaccinations and shots. So I thought that this would be the next segment that we would talk about, vaccinations and kind of what vaccines you need as an adult and what vaccinations you don't need. So let's jump into it. The first thing I'm going to talk about is I'm going to say that vaccinations are definitely a very personal choice. I'm not here to debate or to have arguments or debates about whether or not vaccinations are important. Obviously, as a primary care provider, as a physician, I think that they are important. I think that they are something that are worthwhile. So if you are against vaccinations, this is probably not the video for you. I'm not going to be trying to encourage people who don't want to get vaccinated to get vaccinated. My job in this segment of In the Clinic is to tell you what vaccines you probably need and what vaccines you probably have already had but or may not be aware of, so that way you can communicate with your primary care provider, hope you got one, to say, hey, are these things that I should get or shouldn't get? So there are a lot of vaccinations, so I definitely will be referring to my computer screen. So please bear with me as I go through the vaccines. So the first one that I'm going to talk about is the Tdap, or the tetanus, diphtheria, and pertussis. There's also a version of this, kind of a version of it, that's called TD, which is just tetanus and diphtheria. So the Tdap, or tetanus, diphtheria, and pertussis, that's how I'll be referring to it because I don't necessarily like the TD one. That's just me thing. The Tdap is a vaccination that you really should get every 10 years. So you get one dose and then you get either a TD or a Tdap booster every 10 years. And why is that? Primarily, particularly for the tetanus portion. So tetanus is something that can occur, or I guess it's something that you can get if you were to come in contact primarily with rusty nails and rusty metal. So you want to protect yourself from getting Clostridium tetani, which I think is the bacteria, which can cause lockjaw. It's very painful and very debilitating, can be life-threatening. So the Tdap vaccination helps protect you against that. The other part of the so the Tdap, the other part is diphtheria. And diphtheria pretty much is a bacteria that we really don't see a lot in America, and the reason why is because of the vaccine. It's from a bacteria, Corynebacterium diphtheriae, if I remember my microbiology correctly. But that vaccine, so that part of the vaccine is also in the TDAP, the Tdap portion. And then the P stands for pertussis. And pertussis basically is known as the whooping cough. So, this vaccination or this vaccine is one that usually you got when you were a child and really just need a booster every 10 years. One thing that I will tell patients are if you are particularly like into working with wood, working with metal, if you're, a mechanic or if you're working on cars, or if you are in construction, renovating houses, anything that would what's the word I'm looking for? Anything that would cause you to encounter metal, and where you're likely to get a cut or a puncture wound, barbed wire, farmers, things like that. This is a vaccine that you want to make sure that you really do stay on top of. And the reason why is because it can have some deleterious effects, and nobody wants to be getting an immunoglobulin shot when they could have just had a Tdap every 10 years and taken care of this. So it's one definitely that I recommend. The other time that you may hear about getting a Tdap vaccine is if you're pregnant, or you are the spouse of someone who's getting pregnant, or you're the grandparent or uncle, aunt who's going to be spending a lot of time with the baby. The newborn parents or the new parents might be requesting that you get your Tdap for that particular purpose, in order to protect the baby from possibly contracting pertussis, as well as protecting you. So it's a good idea to get that vaccine done if you have any of those possible life events going on. So let's move to another vaccine. The other vaccine that I would talk to you about is the MMR, or measles, mumps, and rubella. And usually this vaccine is covered in childhood immunization, so this is actually not one that you would need to worry about getting as an adult unless you're pretty sure that you did not get this in your childhood immunization record. There is a way that we can do what's called MMR titers in the lab to see if you still have immunity to these, and if not, you can get boosters. And if you are, then you're good and don't have to worry about that vaccination. So, if you were born before 1980 like myself, you probably had the chicken pox, and you can remember having like these bumps and itching all over. And so this brings me into talking about the varicella vaccine, or the chicken pox vaccine. So there are 2 doses that you should get if you were born after 1980, and likely you got those vaccines again in childhood. But if not, it might be a good idea for you to talk with your primary care provider about whether or not you need to be immunized against varicella or not. Okay, varicella, you probably will be talking about getting like a varicella, or what's now called Shingrix vaccine, after the age of 50. And this is basically, I like to think of it as a booster for your immune system. So one thing that can happen, unfortunately, as we get older is our immune system wanes, and things that didn't used to bother us can bother us. So if you did have the chickenpox, or even if you had the varicella vaccination, chickenpox, or what I like to call what's also known as herpes zoster, actually lives inside you, and lives inside of the nerve roots in your body. I know that sounds really, really parasitic and gross, doesn't it? Yeah, it does. But it's actually what happens. And what can happen as our immune system wanes, or we get under stress, and I think the pandemic has caused a lot of stress for a lot of us, is that once we have like kind of this right cluster of events, it can actually cause a reactivation of this virus inside of us. And that virus travels and infects or irritates the nerves of the ganglion that it sits in. And so we can get what's called post-herpetic neuralgia, or we can get a really bad rash called shingles that typically follows a dermatome, which is basically a nerve pathway root of the skin. And that's usually how it gets activated and causes this rash that's very painful, and can sometimes, for some patients, be very debilitating. So at the age of 50, there is this option to get the Shingrix vaccine, which is a 2-part vaccine that I do typically encourage patients over the age of 50 to make sure that they get, because it does lower the incidence and risk and pretty much protects you from having a reactivation. It's that effective. So let's talk about the HPV vaccine, or the human papillomavirus vaccine. So when I was coming up in medical school, this actual vaccine was pretty new, and was really kind of getting its foothold in the door, as far as being a great opportunity for us to protect young women and young men from certain types of human papillomavirus that can cause cervical cancer. And it's kind of revolutionized how we look at cervical cancer treatment. I wouldn't say treatment, but protection. And so it is one that initially you had to be, I think it was less than 25, but now they've increased the age that if you can, that you can get vaccinated with the Gardasil, or with the not herpes, I apologize, human papillomavirus vaccination, I think up until the age of 45. And it's a 2 or 3 part vaccine depending on your age and if you were previously vaccinated. Depends on that. So that's something that I definitely recommend if you are a young man or even a young woman who's younger than 45, that you talk to your doctor about getting if you haven't had the human papillomavirus vaccination. Does this mean that you don't have to get your cervical cancer screening? No. Does this mean that you don't have to see your gynecologist? No. What this does mean is that the types, because there are many types of human papillomavirus, but the types of human papillomavirus that are very well known for causing cervical cancer, it does protect you from those. And so it's definitely worthwhile to get. Yes, you can still get HPV, but hopefully you won't get the types that can lead most commonly to cervical cancer. So let's talk about hepatitis A and B. This is usually a vaccine that you may or may not have had. It's usually a vaccine that can be given together or they're given apart, but it is one that protects you from hepatitis A and B. It is a 2-dose vaccine. I think it's a 2-dose vaccine series for hepatitis A, and if I recall correctly, a 3-dose vaccine schedule for hepatitis B. You can check and see if you have immunity. Your primary care provider can do some lab work to check to see if you have immunity for hepatitis A and B. And if you do, then there's no need to get the vaccine done. But if you don't, it is one that I definitely recommend that you consider, because hepatitis B in particular can lead to cancer. So that's actually a vaccination that I definitely would recommend that you talk to your primary care provider about. So then we can talk about meningococcal A, C, and B. So if you are a young person who is going off to college, likely staying in a dorm or staying with others, having a roommate, meningococcal A, C, and B are definitely vaccines that I recommend that you consider getting, just because meningitis, meningitis can be common in that subsect of the population. As we get older, I really don't necessarily see a need for meningococcal A, C, or B in my older patients who are outside of that college range and aren't really living in dorms anymore or anything like that. So that's kind of what I say about meningococcal. Now, I want to talk about, the pneumonia vaccines. And I wanted to save the pneumonia vaccines for kind of second to last, because there's a lot of misconception that the pneumonia vaccines prevent you from getting pneumonia, and that's just not true. Okay? There are so many different types of bacteria that can cause pneumonia that unfortunately we can't protect you from it all. But the pneumococcal vaccines, Prevnar, which is, I like to think of it as pneumococcal 13, and Pneumovax, which I like to call it pneumococcal 23, protect you against different subtypes of a bacteria called Strep pneumoniae that can cause not only pneumonia, but can cause kidney failure, liver failure, can cause meningitis, and really can actually put people in the hospital and in the ICU because they are some very virulent strains of that organism. If you have any type of chronic health issue or illness, such as coronary artery disease, congestive heart failure, asthma, any type of lung issue, sarcoidosis, any type of immunosuppressive illness, it is worthwhile considering getting the Prevnar pneumococcal 13 vaccination, at least one dose, and then also considering getting the Pneumovax vaccination. After the age of 65, both Prevnar and Pneumovax are recommended no matter what your comorbid health issues are. So we typically do recommend those after the age of 65. Now, let's see. I've talked about the pneumonia, I've talked about the HPV, I've talked about hepatitis, meningococcal. There is a Hemophilus influenza type B vaccine that I did neglect to or forgot to mention. That vaccination is typically recommended for patients who have kind of asplenia, which means their spleen has been removed. So that's the one time that you would consider that one, and usually you get that one I think every 5 years if you've had your spleen removed. We talked about the Zostavax, varicella, we talked about measles, mumps, rubella. Now let's talk about the flu vaccine, and this is the one that I did want to save for the last because this is a very hotly debated and difficult vaccine to really kind of discuss, because it's a vaccine that changes, typically changes every year. And the reason why it changes is because the influenza vaccine is truly based on what strains are expected and thought to be particularly prominent in the forthcoming year. So it is an educated, hypothesized guess. I'm going to be very honest with that. However, they're usually really good in picking them out, but sometimes they're not. So should you get the flu vaccine every year? I would say yes. Now, typically in my practice, I will say that there are a lot of other vaccinations that I'm trying to get people to get done. So I don't typically push back a lot on patients if they say they don't want to get the flu shot, because I'm trying to get some other ones that I think are more important, and I know that I can just try again next year. This year, however, I'm taking a different approach, and the reason why is because of the pandemic. I'm going to be completely honest in that regard. I will say that as a provider, I am very highly concerned about the implication of patients coming in contact with COVID and also coming in contact with influenza. I am concerned because coronavirus, COVID-19 is so new, and we have no idea. We're just learning about the things that it can do to the body. And then you tap onto that or add onto that influenza. And I just feel, in my medical opinion and really truly in my spirit, that is a recipe for disaster. So I really, really encourage you, if you were not one that got your flu shot every year, this is the year. This is the year to get your flu shot. Why? Because COVID-19 is out there. A lot of people will say, well, I got the flu shot and it made me sick. The influenza vaccine is not a live vaccination, so technically it should not make you sick, okay? With that being said, I will say that it will cause an immune response reaction in your body. You might feel fatigued. You might notice some aches and pains that you might attribute to, I have the flu. Typically what I recommend for my patients is, if they can take Tylenol or Advil, I typically recommend when they get the flu vaccine that they take Tylenol, extra strength, 2 in the morning, 2 in the evening for the next 72 hours, and then stop. And that usually helps them not feel as bad as they would if they didn't. However, I will say that there's been no relationship shown that if you get the flu vaccine, that you're going to get the flu. What has been shown is that patients and people who wait to get their flu vaccine until much later in the year may be exposed to influenza or the flu or even the common cold, and then will get the flu vaccine unknowingly, and then just happenstance of the timing of when they got the flu vaccine, their symptoms occur from their previous exposure to flu or just the common cold, and then the juxtaposition of the two make them think and feel that they got the flu from the flu vaccine. So take with it what you will, you do what y'all want to do. But my recommendation and what I am encouraging my patients in my practice to do this year is that if you are willing to get any vaccine, please, please, please consider getting the flu vaccine this year. I really do highly recommend it. One of the things that my patients were asking me today that I was seeing them is, what time should I get the flu vaccine, Dr. Holmes? I've heard that it lasts only for about 6 months, so should I wait until November? My timing for getting the flu vaccine is usually end of September, beginning of October to middle of October. That's the time I typically recommend that patients get the flu vaccine. And the reason why is because, one, you beat the rush of everyone trying to get their flu vaccine in September. And then two, I don't think it's late enough in the season to where you won't be protected soon enough. So that's typically what I recommend. Now with the influenza vaccine, there is a high dose influenza vaccine that is recommended for patients 65 and over. And I do recommend patients 65 and over do consider getting the high dose influenza vaccine. My same recommendation still goes with taking Tylenol twice a day for about 3 days if you do get the influenza vaccine, just because it can cause an immune response that some patients do find uncomfortable, but those would be my recommendations. So I think I've covered all of the vaccines that I typically encounter and think about in my practice. If you have any questions, always talk to your primary care provider. That's what they're there for. Yes, you'll have to pay a copay. I'm not even going to lie about that. But our job is not just to dole out medication. Our job is not just to, push drugs on you. Our job is to educate and to have discussions with you. So talk to your doctor, talk to your nurse practitioner, talk to your PA, and ask them what their thoughts are regarding vaccinations. Have a discussion. And if you don't get answers that you like, I shouldn't say that you like, but if you don't get answers that you understand, push them on it. Say, I still don't understand. Help me understand a little bit better. That's our job. That's our role. Now, I will be doing a blog post for this particular vlog. So do check out the blog if you want to look at the CDC screenshot that I use and look at when I'm trying to figure out what vaccinations my patients need. Check that out. Or you can actually go to the CDC website. So I think that's it. Yeah. I think I'm done. So that's me for you. So if you liked this content, please comment and let me know. Hit the like or thumbs up. And if you want to see more videos, please just make sure that you subscribe. Make sure you ring the bell. Make sure that you like, and please make sure that you share this content. It's not just for you, it's for everyone. So please make sure you share. Stay safe and be safe out there, and wear your mask. Smooches. Until next time.